Hello everyone. So today's topic of discussion is on febrile seizure. It's a very important topic with regards to pediatrics. So febrile seizure, first of all, I'll be talking about the presentation and then I'll be going to the slides. So whenever we talk about febrile seizure, any patient who comes with fever and seizure, okay, fever and seizure from 6 months to 5 years of age, okay. So the time duration is 6 months to 5 years of age. Okay, so there is, whenever there is fever, there is seizure. Okay, that is the febrile seizure without any kind of other association. That is, basically there should not be any kind of intracranial infection like scenario. For example, if the child is more than 2 years, like for example the child is 3 years and he has meningitis, and then because of meningitis he has seizures, so that is not febrile seizure. Okay, so that is there is seizures associated with meningitis. Okay, one of the most common cause of status epilepticus in children is also febrile convulsions. Okay, so febrile seizures can lead to status epilepticus also. Okay, so the most important thing what you need to understand is whenever you have febrile seizure, there is chances of recurrences. There is chances of recurrences. So how would you understand that whether if there is febrile seizure and then there can be recurrences? So how can you understand that? Okay, so you need to understand that whenever I've started in this way. So there is a major criteria and a minor criteria. Major criteria is FDA and minor criteria is CF meds. Okay, so I've started in this mnemonics. Okay, so let me write it down for you. So major criteria is FDA, and minor criteria is CF meds. Okay, so CF meds. So wherever there is, how can you evaluate that there is a chance of recurrence? Okay, so how can you evaluate that there is a chance of recurrence in this case of febrile seizure? So you need to remember that age, so A refers to age. Age is less than 1 year, there is high chance of recurrences. Duration of fever is more than 24 hours. The duration of fever is less than 24 hours. And if there is fever, a fever which is about 38 to 39 degrees Celsius, So if this is the fever, there is a chance of recurrences. Okay, and this CF meds means if there is family history of febrile seizure and family history of epilepsy, so this F and E is cut. Okay, C refers to D is a daycare. D refers to daycare. S refers to serum sodium is less at the time of presentation. M refers to your male gender, and C refers to your complex febrile seizure. Okay, complex febrile seizure. So febrile seizure is basically divided into two types. So first we will talk and then we will go to the slides. Okay, so febrile seizure is divided into two types. So one is a simple febrile seizure, or one is complex febrile seizure. Simple febrile seizure means if the duration of seizure is less than 15 minutes, and if it is a generalized tonic-clonic type, it's a simple febrile seizure. Complex febrile seizure means the duration is more than 15 minutes, and the seizure is of focal or generalized tonic-clonic size. See, remember, if the seizure is focal, so it is a complex seizure. So if the seizure is generalized tonic-clonic, it can be both either complex or it can be either simple. Okay, one more thing, that in 24 hours, so if you have more than one episodes of seizure in 24 hours, it is a complex seizure. So I told you three basic important things that you need to remember. One is the type of seizure, other one is a duration of seizure. Okay, duration of seizure, 15 minutes, more than 15 minutes or less than 15 minutes, and duration like one seizure episode or more than one seizure episode. Okay, and complex seizure, there is a history of familial history of febrile seizure or complex or epilepsy in the case of complex seizure. Whereas in the complex seizure also there is role of CT MRI, there is a role of EEG. Okay, there's a role of lumbar puncture. See, why are we going for lumbar puncture in the case of febrile seizure? Remember, if the child has missed any immunization, okay, and if there's signs of meningitis, then we have to go for lumbar puncture. Remember, the signs of meningitis like nuchal rigidity and your Koenig sign and Bruch-Jahnke sign are not present in the case of okay, so in the case of any seizure, any child who is presenting more than 2 years, so this sign are present, but less than 2 years, these signs are absent. Okay, so febrile seizure. So seizure is a transient occurrence of signs and symptoms resulting from abnormal, excessive, asynchronous neurological activity in the brain. So remember, so seizure is actually there's difference between seizures and epilepsy. So epilepsy means more than equal to 2 seizures in time duration of 24 hours, which is unprovoked. That is epilepsy. Seizures means it's a abnormal synchronous neurological discharge which presents as motor activity, autonomic signs and symptoms, okay, or it can be sensory abnormality, okay. So motor activity, so they can be generalized tonic-clonic, they can be a jerk movement like in the case of myoclonic jerk, or they can be a yes, they can be a staring gaze look, that's an absence seizure, okay. So febrile seizure may present as generalized tonic-clonic, or it might present as a focal seizure, okay. So febrile seizure is the rectal temperature is 38.5 degrees Celsius. That gives you a definition of febrile seizure. So along with seizure, there is fever and there is no other signs of infection, maybe meningitis, maybe encephalitis, or any sort of trauma that can be categorized under febrile seizure. So febrile seizure is a seizure that occurs between the age of 6 months to 6 years with a temperature of 100.4 degree Fahrenheit or higher, and there are no results of CNA infection or no any metabolic imbalances that occur in the absence of history of prior febrile seizure, okay. Now febrile is the most common of seizure or disorder in children that affects about 3% of children. The age is 6 months to 6 years, okay. It's rare, peak onset in 14 months to 18 months, and rare before 9 months of age. So it's more common to male. That is why in the case of the CF meds, I told you that M refers to male gender, okay. So it's more common to male. Rapid rise of temperature may be important. 44% of the infants experience seizure within less than an hour of fever. 13% have seizures with more than 24 hours of fever. Yes. So here, whenever we talk about duration, the major criteria, the duration was less than 24 hours. So in less than 24 hours of fever, you will get a seizure, okay. But sometimes what can happen is the duration, it becomes like more than 24 hours, okay. So just remember, if it's a single episodes in 24 hours, then that's a simple seizure. But it's a multiple episodes, so more than one episodes in 24 hours duration, that becomes a case of a complex seizure, okay. So whenever we talk about risk factors for the first febrile seizure, I already told you about the mnemonics, that it's very easy. FDA, so it's a FDA criteria. We have learned about FDA criteria a lot, right? That FDA and clinical features are understood by the medical professions, right? So CF meds. So family history of febrile seizure, complicated neuronal course, more than 28 days in the hospital, development delay, childcare attendance, and very high fever and hyponatremia at the time of presentation. Just remember that the child is neurologically normal in the case of febrile seizure, okay. So whenever it comes to febrile seizure, so the definition for febrile seizure says that the child, so it's a seizure which is seen in 6 months to 5 years when the rectal temperature is more than 38 degrees Celsius and the child is neurologically normal, okay. The child is neurologically normal. But in the case of, like in case of febrile, in the case of complex seizure may be associated with neurodevelopmental delayed child, okay. Got it or not? So febrile seizure as a whole definition is, it is not associated with any developmental delay, okay, but complex seizure is associated with neurodevelopmental delay, okay. As a whole, when we talk about febrile seizure, it's just seizure and there is fever, okay, but there is no signs and symptoms of the infection. There is no infection. But in the case of your complex seizure, so it might be associated with the family history, or it might be associated with some child having a neurodevelopmental delay, okay. So there are some genetic predisposition of the child, okay. So there are certain genes, so I've written in my copy, I'll just recite it for you. So SCN1A, so I'll write it down. So it's basically SCN1A, SCN1B, SCB9A, and CPA. So if you can remember these genes, better answer, okay. So SCN1B, SCN1A, and SCN1A, SCN1B, SCN1A, SCN1B, and then you have SCB9A and CPA6. So I'm just looking for my copy and I just wrote it down for you, okay. So it's not written in this slide. So children of the parents who have febrile seizure of the risk for four, okay, of course. So siblings, Monozygotic twins, right? Inherited disorders. Now remember, as I already told you, someone who has missed immunization, more commonly with DPT, diphtheria, pneumococcus and tetanus, measles, they are highly prone to getting seizures. And someone who's having missed immunization and the signs and symptoms of meningitis if present, you have to go for a lumbar puncture, okay? So simple febrile seizure, complex febrile seizure. What's the difference? Generalized type, focal type. Duration less than 15 minutes, more than 15 minutes. Single episode during the time of illness. Repeated episode during the same illness, right? 6% of the febrile seizures are prolonged and 80% of these are initial seizure. The initial febrile seizure is complex in 25% of the patient. And it can lead to status epilepticus, okay? It can lead to status epilepticus. So generalized tonic-clonic can be both. Can be a simple or a complex. But more commonly, simple. Complex is a focal seizure. So patient comes, febrile seizure. If he is presenting with status epilepticus type, then you go with the management of status epilepticus. You have to maintain airway breathing circulation. Of course, look for tongue biting, fall of tongue, okay? So usually neonodal seizure, they present with something which is known as a subtle type of seizure. So there's nothing like a generalized tonic-clonic. Subtle seizure is a neonodal seizure. We'll be talking about neonodal seizure in next video. Okay, so detailed history. So just go for a laboratory investigation, look for the metabolic abnormalities. So more commonly hypoglycemia associated seizures. Look for infection signs and symptoms. If more than 2 years, if less than 2 years, go for lumbar puncture. If it's a case of misimmunization, find focus of infection. So in the case of meningococcal infection, so there can be petechial rashes can be there, right? So they can be bruising. So you can just rule out these things, okay? So past history of seizure, any family history of seizure, or any if he's taking any sort of medicine for seizure, okay? And so ENT examination must be done. Why? Because yes, of course, because associated AOM, staph, group B streptococcus, Moraxella catarrhalis are the important organisms associated. Klebsiella is associated organism for AOM, and these may provoke seizure. CNS examination, go for a neurological signs and symptoms. And differential diagnosis is meningitis, meningoencephalitis, epilepsy, and brain abscess, right? Yes, of course, I already told you lumbar puncture for someone who has missed immunization, and someone who has signs of immunization, someone who has signs. So it's written there, more than 18 months on clinical ground. So more than 18 months, more than 2 years, you're able to see the child's, the signs and symptoms well clear, okay? But less than 2 years, it's very difficult to elicit the signs. So in that cases, we have to consider lumbar puncture, okay? Neuroimaging and EEG is of importance in the case of your complex seizure, but there's no role in the case of simple seizure, okay? So you have to give, lorazepam, you can give, or you can give midazolam, okay? Diazepam, midazolam to 0.2 mg per kg dose, okay? Antipyretic and TED with sponging. Main is just comfort the child with seizures. You give antipyretic, so if you control fever, the seizures will be controlled by its own, right? And treat the underlying illness and counseling the patient out. So remember, so if there's a chance of recurrences, then you have to go for intermediate prophylaxis also. So for example, if the child gets an infection, so immediately you have to give, along with antipyretics, it's better you give for drugs like clobazam and diazepam, okay? So usual drug use is clobazam, okay? Counsel parents on first aid management during seizure and early institution of antipyretics, give reassurance and information, okay? Intermediate prophylaxis, so someone who's having a repeated, so what's a criteria for recurrent febrile seizure? So if it's in 6 months duration, so in 6 months, if 3 febrile seizure, that's a recurrent. So in 1 year, if it's a 4, okay? It's very easy. So remember, 6 months, the multiple of 3 2s are 6, right? So 3 into 2, 6. That means 3 febrile seizure if he has in 6 months duration. That's a case of recurrent febrile seizure. Or 4 febrile seizure in 1 year is also termed as recurrent febrile seizure. In such cases, or if the risk factors are more, in that case you have to give intermittent prophylaxis. So prolonged febrile seizure lasting for more than 15 minutes, that's basically definition for complex seizures. So child with repeated febrile seizure and two of the following risk factors. It's basically one focal or repeated seizures within 24 hours, two neurological abnormalities or development delay present, right? So all the criteria for complex seizure needs intermittent prophylaxis. Okay. So if the intermediate therapy has failed, then you have to give continuous prophylaxis up to 5 years of age, and you can give drugs like phenobarbital. Okay, you can give drugs like phenobarbital, or you can give valproic acid. Okay, but for the case of intermittent prophylaxis, is basically your clobazam and diazepam. Okay. Risk factors, as I already told you about complex, this risk factor FDA and FC meds, you can remember from that. And this chart is quite important for as in a PG MCQ entrance exam. So if the child has simple febrile seizure, the recurrence is 1%. If the child has recurrent febrile seizure, the risk is 4%. Complex febrile seizure, it's a 6%, and the all is explanatory. So this is just like mocking up things, so I don't want to go much more over here. And that completes our, see why it's basically, like an ear being examined, maybe associated ear infection can lead to febrile seizure. So it's better to correlate things with pictures. Okay, so we complete our febrile seizures topic. So that's it. Thank you.